Patients with either AML or ALL with relapse disease have a very poor outlook. At the present time, most institutions, either in the United States or Europe, do not transplant patients who have active leukemia. At City of Hope, we developed a special approach using a new targeted form of radiation therapy called total marrow lymphoid radiation, where the maximum dose of radiation is given to the skeletal system where leukemia resides, and this is given in combination with 2 chemotherapy drugs. From prior studies, we've documented that we can safely deliver 2000 centigrade to the skeletal system. While using TMLI, we are able to spare the amount of radiation that the normal organs receive. In this study, it was made up of approximately 74 patients, all with either relapse refractory AML or relapse refractory ALL. The upper age limit was 60. These patients had failed, several of these patients had failed venetoclax therapy in the past. Most patients either had adverse or intermediate risk cytogenetics. For the results of the study, we found that our non-relapse mortality for our AML patients were below 10%, which is highly significant in this refractory group of patients. For our ALL patients, the non-relapse mortality was slightly higher because initially we allowed inotuzumab treated patients. After we found a greater risk of these patients developing sinusoidal obstructive syndrome, these patients were excluded from the study. Using this approach, our 2-year overall survival is approximately 45%. Our progression-free survival is around 30%, which is much higher than what you would see with other conditioning regimens. What we've also found that patients who had more than 20% blasts in their blood, who just had received prior venetoclax prior to transplant, had a much higher risk of relapse. In conclusion, relapse is still the major cause of failure and in future we need to try and enhance future immunotherapeutic modalities to try and further reduce the risk of relapse.